of ultrasound. The main bioeffects of ultrasound are thermal and mechanical. When we talk about thermal, that's the heat production, and then mechanical is the cavitation, the bubbles that can be formed. Usually, in an adult patient, these bioeffects are not problematic. They're more problematic in the fetus and the newborn. So it's more of a problem in neonatology and if you're scanning a baby, so you have to understand how it can affect the baby. You know, uh, it can increase the temperature, and as a result, produce problems there, and then it can cause bubble formation. So um, again, ultrasound is or sound wave is a form of mechanical. Uh, is a mechanical wave, right? We went over what's a mechanical wave as opposed to an electromagnetic wave. Your mechanical wave requires a medium to be transmitted through. You need a medium, whereas your electromagnetic wave does not require a medium. Um, and again, waves transport energy. Okay, so ultrasound is a form of mechanical energy. It penetrates the tissue as an oscillating wave of alternating pressures. And the pressures, we measure it in what we call megapascals or MPa. Okay, um, so the factors affecting the hazard potential of ultrasound. Um, we talk about the total acoustic power or the ultrasound energy. That is the total amount of energy that you're getting from the ultrasound. Remember, when we talk about power, remember we did power. Power is energy per unit time. Okay, went over that. Okay, so if you look at the total acoustic power, um, uh, and then you look at the tissue composition. So those two things will affect, will result will tell you what's going to happen. The amount of power that the ultrasound is transmitting, and then the tissue composition. So some tissues are more susceptible to ultrasound damage than others. So the more proteinaceous the tissue, the more susceptible to thermal injury. Okay, the higher fluid and gas content of the tissue, it's make it more susceptible to bubble formation. Okay, so the more fluid and gas, the more bubbles that you'll get forming as a result of your ultrasound procedure. And then as I said, more protein, then the more thermal, the more heat production you'll get. So when you're looking at the hazard potential of the ultrasound, you're not only looking at the output power of your ultrasound system, but the tissue that you're examining. So tissue susceptibility, we talk about the rapidly proliferating tissues such as fetal tissue, and that is why the fetus and developing embryo is more susceptible to ultrasound injury because the tissues are still rapidly growing. So once the cells are rapidly growing, they're more susceptible to ultrasound injury. So, we know adult tissues have static cell population and are not affected as much. So, in the clinical settings, it depends on the injury, depends on the type of transducer you're using, the depth of penetration, and the overlying layer of tissue. So those things are important in injury. Um, Generally speaking, Doppler ultrasound can cause significant temperature rise compared to B mode and M mode and three-dimensional ultrasound. So when you're imaging, if you do fetal imaging or imaging of, uh, you know, a young baby, you want to limit the Doppler use. Okay, you want to limit your Doppler use because it can cause more temperature rise. Um, as you say, the two effects are two main effects. There are other effects, but the two main effects is temperature and cavitation, which is bubble formation. Okay, so the mechanical effect, which we refer to as cavitation, is just basically um, the ability of the ultrasound to form bubbles, and then as we mentioned before, the higher the fluid content or the fat content, the more cavitation you'll get. So it refers to the development of gas bubbles in an acoustic field at high negative pressures. Okay, so the mechanical effect is very important. So if you when you do your ultrasound, you can get development of gas bubbles. You can develop bubbles, and the bubbles vibrate at a critical size, and that means they're growing and collapsing. That's the increase and decrease. Um, uh, so that's basically what happens there. So you can get injury as a result of cavitation. So when bubbles form, um, the bubbles uh, when the bubbles rupture, you can you get free radical release, and in developing embryo or fetus, you can get injury damage. So again, the bubbles oscillate, okay, and they can rupture and then cause problem. So if so, what you need to remember is just ultrasound can cause increase in the temperature, or it can cause cavitation or bubble formation. When we talk about mechanical index, and then mechanical index is going to be important in the next lecture, because we're going to deal with contrast, microbubble contrast, and you have to know the definition of mechanical index. What is mechanical index? The importance of mechanical index. When you look at your ultrasound screen, you're going to see something. You're going to see TI and you're going to see MI. The TI is your thermal index and your MI is the mechanical index. Mechanical index is very important when you're doing contrast echo, because the definition for mechanical index um, is the peak negative pressure divided by the square root of your center frequency. Okay, peak negative pressure divided by the square root of the center frequency. What essentially the mechanical index is the ability of the ultrasound system to rupture bubbles. Okay, if you just that's a very crude definition, but the mechanical index. So if you have bubbles inside the body or whatever tissue you're imaging, you can use your ultrasound to rupture those bubbles. Okay, that's what we call mechanical index. So when we do contrast imaging, we usually use contrast echo those patients who give you a poor image, you can't see the endocardial border clearly. So you have what we call a suboptimal study. You give these microbubbles, you inject the microbubbles, and the microbubbles just stay in the cavity. It doesn't go into the muscles. Usually, it doesn't go into the muscle. So it outlines what we call the endocardial border, so you can see the wall of the heart. However, if the ultrasound system, if you turn your mechanical index too high on the ultrasound system, it can rupture these bubbles, and then you're not going to see anything. Okay, so a crude definition for mechanical index is the ability of the ultrasound system to rupture bubbles. So we talk about the safety index, and that is the likelihood of cavitation events. And again, the definition for your mechanical index is your peak negative pressure divided by the square root of the center frequency. Again, the peak negative pressure is in millipascals, okay? And the center frequency is in megahertz. The FDA, which regulates a lot of these systems, recommend that the mechanical index should be less than 1.9 to minimize risk. However, if you're doing a contrast echo, if you're using microbubbles, your mechanical index should be, depending on what type of system and what type of study you're doing, should be less than 0.5. So you have to know that, because if you leave your mechanical index as 1.9, you're not going to see anything. You're going to get swirling. All right. So the threshold for capillary injury in animals is about 1 megapascal. Okay, so in certain animals you can damage the capillary if you use a mechanical index of 1 millipascals and using a center frequency of say 2 to 10 megahertz. You probably have seen ALARA. What it means is as low as reasonable achievable. So whenever you're doing any type of imaging, you always refer to what we call ALARA, as low as reasonable achievable. So you use whatever parameters and you do your adjustment. You're going to reduce everything to the minimum that you can get a very good study. Basically, that's what it is. So while obtaining the best possible diagnostic image. Okay? So if you see any official reports, it always talk about ALARA, as low as reasonably achievable. So you're going to reduce your mechanical index. You're going to reduce everything to get the best possible. Once you get a very good imaging, a very good image, that's what that's what you're trying to achieve. Okay. Again, ultrasound is a form of mechanical energy. Okay. You get acoustic streaming and torque, twisting and spinning forces, streaming of fluids, cell distortion. Basically, you get bubble formation, and when the bubbles rupture, they can release free radicals and stuff, and then they can cause injury to tissues, mainly fetal tissue, because it's only in tissues that are rapidly growing that you get these things. And remember, Doppler will cause more mechanical injury than your regular 2D and 3D echo. Now we move on to the thermal effect of ultrasound. So basically, it's gonna heat up the tissue. Okay, so the thermal index is an indicator of temperature elevation. Okay, so if you do your scan and the power is very high and you scan for a long period of time, you can eat up the tissue. But the definition for thermal index is the acoustic power used to the acoustic power used to the power required to produce a temperature rise of 1 degree Celsius. So it's the acoustic or acoustic power used to the power required, okay, to produce a temperature rise of 1 degree Celsius. So it's not 1 degrees Fahrenheit, it's 1 degree Celsius. And there are usually three subdivisions. So when you look in the ultrasound system, it will have TIS, TIB, and TIC. So it means thermal index of soft tissue, thermal index of bone, and the thermal index in adult cranial tissue, if you want to call the cranium a tissue. Okay, so that's what these things mean. So you should look at the front of the monitor and try and explain everything that you see there. So you might just see TI, thermal index, but you might say TIS, the thermal index in soft tissue, bone, and adult cranial. But you have to know the definition for thermal index. So it's the acoustic power you use to the power required to give you a temperature rise of 1 degree Celsius. So again, when we talk about ultrasound sound wave is an energy transport phenomenon. And as we mentioned before, energy can be transformed from one type of energy to the next. Okay, you cannot create or destroy energy. It is usually just transformed. So similarly, the sound energy is can be converted and will be converted to heat energy. Okay, and again, remember, heat is teratogenic. That means it can damage the developing fetus. So rapidly growing cells and tissues are susceptible to heat. So if you're doing a fetal ultrasound and you're using a Doppler for a long period of time, you can cause damage. Okay, and it has been shown that temperature rise above 1.5 degrees Celsius does cause some amount of teratogenesis. So you should always keep your temperature rise up below 1.5. Okay, so this just look at your thermal index and the maximum exposure time. So if you're doing a study in an embryo and and you spend 60 minutes, your thermal index will be about 0.7. If you spend so if you're gonna spend 60 minutes doing the study, you should the maximum recommended exposure time for this TI would be 60 minutes. If your TI is 1, then you should only spend 30 minutes, 1.5, 15, and 2, 4 minutes. Because if you spend a long period of time doing these studies, you can cause damage, thermal injury. But the important thing, it's more of a problem in obstetrics and gynecology. So the important thing is to limit, if you're doing ultrasound in a fetal ultrasound, try not to use your Doppler. Limit the length of the study. So the two main problem with ultrasound, the bioeffects: thermal, which is heat, and mechanical, which is bubble formation. So, all right. So we have finished